With the rate of diabetes in Canada on the rise, Markham Stouffville Hospital's Diabetes Education Centre is at the centre of providing patients and their families with treatment and education. Dr. Lila Bashara from the Diabetes Education Centre is here to tell us more about the disease and how the longest-running diabetes program in York Region is focusing its patient care on the community. This is Daily Web TV. So, Dr. Bashara, what are the types of diabetes that you see here at the center?
We see primarily three kinds of diabetes. Type 1 diabetes, where there is defect in the production of insulin because the cells that are making insulin are destroyed, are programmed to be destroyed. The second type, which comprise the majority of cases that we see, is the type 2 diabetes, where patients have a combination of less production of insulin and also resistance to the action of insulin. The third kind is the gestational diabetes, which is a condition that affects pregnant women and where the diabetes is primarily diagnosed for the first time during the pregnancy, and most of the time it goes away after the pregnancy, although they have a high predisposition to have type 2 diabetes later on in life. Most patients with diabetes do not present with symptoms. It's usually found on incidental blood work, on routine blood work, on screening. Patients with type 1 diabetes, which are the minority of diabetes that we see, they present with symptoms of excessive thirst, excessive urination, weight loss, and blurred vision. However, the majority of patients with diabetes that we see are patients with type 2, and most of these patients are asymptomatic, and diabetes is diagnosed on blood work. With type 1 diabetes, there is no prevention. Type 2 diabetes, part of it is genetic, and it's worsened obviously with lifestyle, and lifestyle changes in the form of weight reduction, healthy diet, and exercise have shown to reduce the progression of prediabetes to diabetes. So screening is very important. Patients who are at high risk for diabetes should be screened on a regular basis, should be aware of the risk for developing diabetes. So patients at risk are patients with positive family history of type 2 diabetes in their immediate family, women who've had gestational diabetes, overweight patients, patients of some ethnic group like Southeast Asian, natives, and Africans, women who had history of gestational diabetes. The Diabetes Education Center at Markham Stouffville Hospital offer a variety of educational classes and programs for people with pre-diabetes and people with diabetes and different kinds of diabetes. We are accessible, which is very important to all family physicians. Actually, we also accept self-referrals from patients, so the center is accessible to patients with abnormal glucose levels, and they get education with regard to diet, monitoring, lifestyle changes, and even a weight loss program. The key message is awareness, screening, and early detection of the disease and control of this disease to prevent complications.
My family doctor recommended that I come and see Dr. Bashara because my sugars were running very high. And I had a risk of having a heart attack, and it happened, like I had blocked arteries. And after that, I made sure that I come and see Dr. Bashara, and they put me on to the dietitian here, which helped me a lot. They showed me how to read the labels and how to control the sugar and what portions to eat, and showed me how to pick the food with the high fiber, low sugar, and that has helped me to control my sugar so far.
Well, my doctor, when he did my physical, he figured my blood level was on a watch, so he recommended me to the Markham Stouffville Diabetic Clinic. And I would say it was very informative because it was very helpful for me. It helps me to learn how to better manage my eating, my management of eating, and the type of food that I should eat. Okay, there's a certain type of food that will raises your glycemic and stuff like that. So it was really very good for me. And the good part about it was that I was able to go to the grocery store with a dietitian, and she helps us read the labeling, like with the percentages of the carbs and the sodium and the different things that are in the food. And it really helped me because a lot of the things that I used to buy, after I reading those things, I don't buy them anymore. I just buy the ones that I can read now, and it's really informative and it's very helpful for me. And it will be helpful for other people as well.